I just wanted to say that we serve the senior population, and as Mark said earlier, the highest rate of suicide in Virginia is 75 to 84. Nationally, it's 85 and above. It's white males, 85 and above. And frequently, seniors don't avail themselves of mental health services. And a lot of times they're homebound, they're isolated, they can't get out of the house. So a lot of times the way they're reached is through services. So that's what our agency does. We provide a lot of services, not necessarily to those who are suicidal, but we may come across someone who is depressed or suicidal in our work. So I'm just kind of going to go through some of the services that we offer. There's also brochures on the table over there. We provide care coordination and case management, caregiver support. Get a lot of calls from caregivers that are stressed out and they need support. We have a coordinated transportation system where we try to coordinate transportation for people who need to get to the doctor, and we also have transportation that's provided to friendship cafes. Those are congregate meal sites where seniors can go to get a hot meal and also get socialization. We have an emergency services fund that's very low right now, so I don't want to advertise that too much. We have a foster grandparent program. We have home care support. We have a respite and in-home services program where we can send someone in to help take care of someone after they've come out of the hospital for a little while. We have home-delivered meals for those who are homebound and need a nutritious meal and don't have anyone to provide it. We provide a lot of information and referral, insurance counseling and advocacy, where people may call, and the whole Medicare, Medicaid, Medigap, Medicare Part D, all of that is really confusing, and we have volunteers who assist people to make sure that they're in the right plan. We have a long-term care ombudsman. Does anyone know what an ombudsman is? You do? Okay, good. The ombudsman is, in case you don't know, is the person that you would call if you had a complaint against a nursing home or assisted living facility. And that person is the advocate for the patient and for the caregiver and will help resolve whatever complaint there might be. They are wonderful. Let's see, we have a medication assistance program for those, mainly for those who don't have Medicare, to get free medications through the pharmaceutical companies. We also have a money management program, which is another just great program for people who I have an example of a woman whose husband died, and he always managed the money in the house, and so she was becoming forgetful and confused, and we were able to put a money manager in there, and that really helps. So that's another great program where we have volunteers that are trained to go into the home and make sure that the bills get paid every month and the checkbooks are balanced and all that. We also have an RSVP, which is a retired and senior volunteer program. We have other volunteer programs. We have lots of opportunities for volunteering. We have a senior employment program for people who are 55 and older, and that's been really active this year because we've had a lot of unemployed people coming in. Some people that are even in their 70s and 80s that come in and they need a job. So we're able to place them in jobs and train them. We also have a Telebridges program, which is a volunteer telephone reassurance program where people get called every day just to be checked on. So that's basically the services that we offer. I was also going to just give you some scenarios of some some things, some some scenarios of people who were depressed and came to us, and we were able to help alleviate the depression by offering services. So we had a 67-year-old male with mobility problems and kidney disease. He was depressed because he was so confined and dependent, and our care coordinator was able to help him apply for Medicaid and referred him to the PACE program. Now he's able to get out and socialize with others, and this has alleviated his depression. We had an older female, I think I already talked about her. She was the one that had the money management program. We had a caregiver from Powhatan who came to the office. And by the way, I forgot to say that we cover the city of Richmond and the 7 surrounding counties. So Powhatan is one of our counties. We had a caregiver that came in who was depressed and talking of suicide to remedy his financial situation. And we were arranged to help him with his mortgage payment for 1 month. We gave him a Christmas gift basket, a gift certificate, referred him to the food bank, and referred his wife to the Friendship Cafe. And he was also referred to Social Security for additional benefits and to apply for real estate tax relief. So those were some things that really helped alleviate his depression. A Goochland resident was assessed for home-delivered meals, and it was determined that she was depressed. The care coordinator referred her to the local community services board, and she began counseling and was put on medication. Let's see, another case in Henrico, a couple with who had been ill and isolated and depressed. They were referred to the local Friendship Cafe, and so they were able to make a lot of friends, and it has really improved their quality of life.